Hello, my name is Zabaglo, Research Fellow at the Royal Cornwall Hospital, and I will be presenting our paper on mortality risk prediction in hip fractures using the modified Frailty Index. There have been no conflicts of interest when writing this paper. People are living longer, and we have seen a rise in the average age of patients presenting to orthopedic services who are increasingly frail. This puts growing demands on services, and frailty has been shown to adversely affect quality of life and result in negative outcomes after surgery.
Currently, the Nottingham hip fracture score is the only validated risk prediction tool in orthopedic surgery. It consists of 7 variables and was shown to accurately predict mortality at 30 days. It includes the number of co-morbidities, but it doesn't factor in specific high-risk medical conditions. The Modified Frailty Index is an alternative risk prediction tool which has been validated in emergency general surgical patients. It's made up of 11 variables: diabetes, COPD, hypertension, heart failure, MI, PCI, peripheral vascular disease, impaired sensorium, TIA, CVA with neurology, being non-independent. We aim to assess the validity of using the Modified Frailty Index to predict both 30-day and 1-year mortality in patients following hip fracture surgery.
We conducted a retrospective study analyzing data over a 3-year period. Inclusion criteria were neck of femur fractures over 60 years old. The presence or absence of the 11 variables that make up the score was noted for each patient, and their overall score divided by the number of variables to give a score between 0 and 1. 30-day and 1-year mortality was then analysed against the MFI score, as well as age, sex and ASA score. During the study period at our trust, 2,085 patients underwent surgery for a hip fracture. 244 patients were excluded for being under the age of 60, having had high energy trauma, and having operations on both sides, leaving 1,841 patients in the final analysis.
The average age of patients was 83.4 years, and the majority were female. The most common ASA grade was 3. The most common MFI score was 0.09, meaning only one comorbidity, with only a few patients having 5 or more.
The overall crude mortality rates shown are roughly in keeping with national averages. An increasing MFI score resulted in increasing mortality at both 30 days, shown in blue, and 1 year, shown in red. The slight dip you can see at the 0.63 point was as a result of low patient numbers, only 7 in that group. There was only 1 patient in the highest risk group who died within 30 days.
Statistical analysis was done using SPSS software. Chi-squared test comparing MFI to mortality was statistically significant at both endpoints with a p-value less than 0.001 for both. Multiple logistic regression was done to compare MFI score to age, gender, and ASA grade for predicting mortality, and showed that the MFI score to be the most reliable predictor at both 30-day on the top and at 1 year shown at the bottom.
Going forward, we plan to compare the Modified Frailty Index to the Nottingham hip fracture score to see if it's a better prediction tool. The Modified Frailty Index is better known in anaesthetic and medical circles, and if validated, can help overall preoperative planning and management of hip fracture patients.
Thank you for your attention.